Hi, I'm Michael Wright. I'm Chief Executive of Nottinghamshire Local Medical Committee, LMC, and our role is to represent, support and advise GPs across Nottingham City and the rest of Nottinghamshire, including Bassettville. Now, the reason I'm just going to give a few minutes to have a little chat with you really is to help you to understand general practice really and the pressures on it, given the recent headlines and media backlash about face-to-face appointments, about GPs being shut, and the recent NHS England letter that unfortunately I think gives the message that you need to be able to demand what care you want, when you want, how you want. And I just wanted to give you a few facts and a little bit of information just to help you really with that decision making, because it's just not really as straightforward as that, and I don't think there's much understanding about general practice and how it works in the general public. And if you're a patient, you can't be blamed for that. Why would you know? So GPs are paid according to a core contract that they have with the government, and what GPs get to provide the care is a kind of a core sum of money, a global sum it's called, and there is extra money that comes in, but any extra money comes with extra work. So just to tell you really, it's £97.28 that the GPs get per year for every patient that's registered with them. And the average size of a practice at the moment is 8,799 patients. That's the average size of the practice. So you can see already that £97, if you were to be seen once a month for any kind of conditions, or not even be seen, but just be in contact with the GPs and them to call you back, if you did that every month, then for them it's worth less than £9 each time. And this isn't about money. This isn't about you feeling sorry for GPs. This is about me being honest with you really and saying, hang on guys, we can't keep loading stuff onto GPs and thinking that it's just an infinite capacity to do this. The point of that is that the money that they get to provide the care to you, and they're the most patient-centered people I've ever met, the most caring people I've ever met, is that money they get is the money that they get to run the business. They're mostly small businesses. They have to pay their staff, they have to pay for the premises, they have to pay for any equipment or anything that they need to run the business and to provide the care to you out of that £97.28. Plus the extra bits, and that money is what they get, and anything they get at the end, or the profits, is what they then take home as GPs in the partnership, the business owners. That's what they take home to put bread on the table, to pay their mortgages. In some cases, I'm really sorry to say, it doesn't work. I know GPs who are not able to keep up, who are taking loans out, who are dipping into the savings, who are getting to the point where they're having to sell things to be able to carry on providing a living for themselves, because the sums aren't working and the demand for people for the care is going through the roof. So if I put this in a more physical way, we were there in general practice under a lot of pressure. Then we had the pandemic, and general practice changed the way it delivered care. It changed. So it went from the point where it was providing a lot of face-to-face care, mainly that was the model, and some telephone consultations, and some of the more advanced ones were doing more on the videos. What the pandemic has done, for very clear reasons, is keep people away from the waiting rooms, to make them safe, to keep the staff safe, and it's revolutionized the way general practice works. So now general practice does a lot of telephone, a lot of video consultations, as well as face-to-face. But the pressure is really mounting, because now we're a year past the start of the pandemic, and secondary care can't cope really with the waiting list. So more people are coming in from the hospitals and coming back to the patients in general practice. Bit more pressure. Then what's happening is that people who have had conditions for some time, been wanting to see the practice, have been able to see them, but it's been hard to get in because there's such a big demand for the time for the GPs. So we have more pressure getting in with your GP. The GPs have been open. They've always been open. They open, their core hours are 8 in the morning to 6:30 in the evening. They've always been open. They don't open at the weekends, but they actually pay, effectively, they pay a small amount of the contract money they could get to pay for out-of-hours services. And actually, they're often staffed by GPs who you see during the daytime. So GPs are still working around the clock, whichever way you look at it. Then we had something that we've got to be very proud about in this country. One of the best performing countries in the world in terms of providing COVID vaccinations. And who leads most of those? Not all of them, but who's behind a lot of them across the country? General practice. It's that family business model, providing COVID vaccinations, changing people's lives, unlocking them, letting them get out more, letting them do more of the things that they haven't been able to do now for every year. It's a brilliant, brilliant situation we have in this country compared to most countries in the world in terms of how many people have had their vaccinations. And they're being provided a lot of the time by your family doctor and their teams, their nurses, and with colleagues making the practices run. And actually, while they're doing that, they can't be doing all the other stuff, catching up with all the paperwork, catching up with the requests for certificates, catching up with all of the referrals or any of the actual work that they need to do outside of seeing you on a day-to-day basis. That's more pressure. It's very difficult. And just while all this is happening, what happens? Well, the media starts telling everybody across the UK that your GPs are shut, that you need to demand the care that you want, when you want it, how you want it. And NHS England then sends out a letter telling practices that they need to provide care in the way that the patient wants, unless there's a clinical reason not to do so. Well, you know where I'm going with this, and I'm not going to pour this all over myself or all over my laptop, but you can see where we're going. I don't know how we reduce that. I don't know how we reduce the pressure and how we make that more manageable without having really good conversations. And that's conversations with MPs, that's conversations with the media, that's conversations with patients and with people in the profession who are working to try and provide good patient care. Please don't abuse your practice. Don't shout at them, don't shout at the staff, don't send really rude messages, text, emails, telling the GPs how they're failing you. I know general practice is high quality primary care. It's high quality work that they do for you. The CQC, the Care Quality Commission, they would prove that if they show you the stats on the scores that are a bit like Ofsted scores. They score the practices. General practice is always right there, right up there at the top of the ladder board, the leaderboard, top of the ladder. They're always up there. It's the place where you get the best care. And it's because it's personal. It's because it means a lot to the people providing it, but it's also their primary business. These guys are seeing you very closely in a way that meets your demands and often in an unmanageable way from a business perspective. But GPs care about the patients. They feel it very keenly when they're criticised. They feel it very personally when the people who are meant to be there at the top of the NHS protecting the sector, protecting general practice, when they criticise as well and when they put out ill-advised communications like they did the other week. The sentiment can understand. What they're trying to say is don't lock the doors and don't refuse to see patients. People aren't doing that. And if you go to your practice and the doors are locked, well, they'll still be open and you should have details on there of how you access your GP. If they're doing that, it's to stop you from walking straight into the waiting room, potentially infecting others. And there's a lot of other people doing that. I went to the dental practice the other day and I was fine with that. They opened the door, they checked whether I had symptoms, they checked I had an appointment, and only when they were satisfied would they let me in. That's fine. I knew they were open. I knew why they were doing that. And general practice mates continue doing that for a little while. So please bear with us. The pressure is intense in general practice. People are going to leave unless we start supporting them, we start caring about them. I don't want you to feel sorry for them. And it's not about pity. They wouldn't want pity. But we need understanding and we need to be grown up. We need to stop the mudslinging. We need to stop being horrible to each other about this. The NHS is the envy of much of the world in terms of the system, free at the point of care for patients. It's amazing, albeit very inefficient at some levels. And general practice is at the heart of it. And if general practice fails and goes down and doesn't work and breaks, then I'm afraid the whole NHS does. And patient care would be much worse, much more damaging to people's lives. It's in all of our interests to support general practice. And I hope that we can have different conversations now. Thank you.